Hi, my name is Claudia Lutz. I'm a biologist at the Carl R. Woese Institute for Genomic Biology, which is at the University of Illinois at Urbana-Champaign. And we are making this video series to inform people about COVID and about COVID vaccinations and to answer common questions and address concerns that people may have. So today's topic is very near and dear to my heart. So I will be talking about COVID vaccinations and their relationship to pregnancy, breastfeeding, and fertility. So my background, I did my PhD at the University of Illinois. I studied the brains of honeybees and how they learn. And so I have some background knowledge about biology, about genes and how they work, and about mRNA. And as we went through the pandemic, I tracked very closely the effect of COVID on pregnancy because, in fact, I was myself pregnant throughout the pandemic. I gave birth in October 2020. And as we watched the potential approval of the first few vaccines, the Pfizer and Moderna vaccines, which are both mRNA vaccines, I was very concerned to understand whether, as a breastfeeding parent, I would be able to have access to the vaccines, whether the vaccines would be safe for my body, and whether they would be safe for my baby as my baby continued to breastfeed. And I also wanted to be mindful about whether I might have any kind of allergic reaction to the vaccines that could impact me or impact my baby. Ultimately, I decided to get vaccinated because as I read more about what we knew about the vaccines and about how they worked, I became confident that they would be helpful to protect me, that they would help protect my community, and that there might even be a way that they would protect my infant while carrying no risk of harming him. So one of the big questions that we get about vaccines against COVID is whether they can impact fertility in any way. And the really relieving news is no, there's no evidence of any link between vaccines for COVID and infertility. So how do we know this? There are actually a number of different ways that we can be confident that this is the case. Well over 120,000 pregnant people have now been vaccinated against COVID, and we see no ill effects on the pregnancies of those individuals related to the vaccines. In addition, even in those early trials last summer and fall of the various vaccines against COVID, those individuals who participated in those vaccine trials were encouraged or informed not to seek to become pregnant or to avoid pregnancy while they were participating, which is a standard procedure for any new drug or therapy that we try to test. We just don't want a person's health situation to be too complicated as we study how something new works. But accidents happen sometimes. And so in those trials, we saw 33 people become pregnant in the vaccinated group and 32 people become pregnant in the control group. So that tells us you had equal chances of becoming pregnant, whether you received the vaccine or whether you received a placebo. In addition, a new study has recently come out that looked at male fertility. So looking at things like sperm count and sperm motility, and found no effects of being vaccinated on those different measures of fertility in men. One specific thing that people may have heard about is a really large study in the US to discover whether there are any temporary effects on the menstrual cycle for people who have recently been vaccinated. So what do we know about this? We know that menstrual cycles vary a lot from individual to individual and within one individual over time due to a lot of different factors. So it's certainly not impossible that something like receiving a vaccine or having a little bit of fever or feeling tired after getting vaccinated might have a temporary effect on the menstrual cycle. And in fact, researchers are looking to see whether there's any pattern in recently vaccinated individuals, whether they report similar changes to the menstrual cycle. This is not new. This is something that we've also studied for the flu vaccine. We've studied it for other vaccines. And in most cases, it turns out that there is no association between these various vaccines and changes to the menstrual cycle. Usually it's just coincidental, but it's always good to look into it and see if there's any pattern. But the really important thing to take away is that even if, for example, people who are vaccinated and did have a bit of a fever have one altered menstrual cycle, that does not mean that their fertility is impacted in the long term. And the way you know this is that lots of things can change a menstrual cycle. So if you have a month of heavier exercise, if you have a cold or another mild viral illness, if you're breastfeeding, or even if you're just really stressed out, that can delay the menstrual cycle. It can make it heavier or lighter for a month or two, or you might even skip a cycle altogether. But that does not have any impact on the long-term fertility for an individual who experiences something like that. Another question people have is the vaccination safe for people who are pregnant? This was something that there was a lot of uncertainty about or confusion about last fall and winter because, as I mentioned in the trials, researchers did not give the vaccine to people who were planning to become pregnant or who were pregnant. So we just didn't have very much information. However, since the availability to the public of the vaccines since late December and early January, many pregnant people have been vaccinated, as I mentioned before, over 120,000. And so now what we're able to do is actually see published studies coming out that look at the safety and the efficacy of COVID vaccinations for pregnant people. In April, there was a very large study that came out that was very reassuring. Many women had received the vaccination while pregnant. Others became pregnant after receiving the vaccination. And what they found is that pregnant people on average actually had fewer side effects of the vaccine, even than other healthy individuals. That there's no increase in pregnancy complications compared to people who were not vaccinated pre-pandemic. And that actually several of the study participants had already given birth successfully. So they'd reached those 40-week mark or so of their pregnancy and given birth to healthy babies who are doing just fine. So all of that is very reassuring. And especially as we learn more about the potential hazards and complications of a COVID infection to people who are pregnant, it really urges that there are many benefits to being protected by the vaccine if you're pregnant or contemplating pregnancy. And we don't really know of any risks either in the short term or to the pregnancy itself or in the long term to fertility to receiving that vaccination. So all of that is very encouraging. So what if you're in the situation like I found myself in, where maybe you have been pregnant and have a baby and are wanting to breastfeed your baby? Is it safe to receive the vaccination while breastfeeding? Again, everything that we know is very encouraging. So many people, including myself, have now participated in studies of breastfeeding women and their babies. There is no altered milk production that we know of, or no alterations to the quality of the milk that's being produced. There are no components of the vaccine itself that are found in breast milk of vaccinated individuals. So nothing of the vaccine itself is being transmitted to the baby, but one of the purposes of getting, or the big purpose of getting vaccinated is to produce antibodies that will protect you from a disease, in this case, COVID. And those antibodies are actually passed through the breast milk to the baby. So as long as the baby continues to consume that breast milk, then the baby will actually be a little bit more protected from COVID because they'll be getting those antibodies. So we hope that this was really helpful. And as you continue to have questions or concerns about COVID or about vaccinations, we really hope that we will hear from you. And please feel free to reach out to us via email via our social media or by visiting our website. Thank you so much and stay safe.